Yes, it's okay.
Both the ways. Got it.
Back to the presentation.
Hello, Dr. Vibha. We are live. We can start the session. Thank you.
Okay. So very good evening to the entire Cloud9 family and our moms to be, whom we also take as a part of our family and shall always be. See, we at Cloud9 with our team of doctors, the obstetricians, the anesthetists, the pediatricians, and our dedicated staff, especially round the clock doctors who are always available and a call away for you. We strive our best to actually minimize the pain and the discomfort and finally deliver happiness to you. And we shall always be doing so. And the pregnancy, though it is 9 months duration and it takes 9 months for the fetus to grow, the labor sometimes is just a day or so, or sometimes few hours. We at Cloud9 definitely understand your anxiety, which is more so towards the later weeks of pregnancy, and also the apprehension associated with the labor and the pain, fear, which is there with the labor, because labor definitely is one of the severest pain which has ever been evaluated. And as you approach towards the end of the pregnancy, the excitement increases and so does the anxiety. And it's usual to wonder that every unusual sign, whether it is taking you towards labor or the day has finally arrived, where you need to pack your bags and go. So, to understand this better, we would definitely like to brief you about the false versus the true labor pains. First, I just want to give you a brief about how the false labor pain works. And with this assurance that whenever the storm of pain comes, we shall always help you to sail better in terms of our team with physiotherapists, dietitians, better understanding with your obstetrician, whether it is related to little counseling sessions. And with this, we want you to understand that the Braxton Hicks contractions, which we keep on hearing about, are known as false labor pains. They definitely prepare you. They are known as a preparation for labor. They prepare you towards labor, but they definitely can never push you towards the labor pain. So, what exactly are Braxton Hicks contractions? Braxton Hicks contractions are basically the muscle tightening, which can start anytime after 20 weeks of pregnancy, more so towards the later weeks of pregnancy. These contractions basically are muscle tightening. They feel more like menstrual cramps. They are mostly on the front part of your abdomen, lower abdomen, and they feel like something hardening. You can, if you keep your palm on the uterus, you can feel the hardening of the uterus, but they are irregular. They are unpredictable, they are irregular, and they can definitely be relieved once you rest a little, keep yourself well hydrated. That is why Braxton Hicks contractions, or so called the false labor pains, are seen mostly towards the end of the day when you've been exerting all throughout or you are dehydrated. And also, or sometimes a warm water bath, having a lot of water fluids will help you to ease out those contractions. But anytime you feel any concern, even if they are Braxton Hicks, never feel reluctant to approach to us, even if it is n number of times before the true labor pains start. The main difference between the Braxton Hicks and the true labor pains are that the Braxton Hicks contractions will never last more than 30 seconds. So there are times when they can last to a minute or so, but this is very rare. They mostly ease out around 30 seconds, and with your change of positions and over the time, they will seem to get better. But true labor pains, once they start, then they do not get lessened or eased out with any other thing apart from if we have taken a decision to give epidural or painless labor. But is it a need to panic with Braxton Hicks? No, because Braxton Hicks are just a preparation towards labor. They do help the uterine muscles to have a better tone. They soften the cervix a little so that it is prepared better for the labor. But there is definitely no need to panic towards the Braxton Hicks contractions. Now, going to the true labor pain. The true labor pains will always be more intense. They will be at regular intervals. Initially, they might seem to be, the interval between two contractions might seem to be a little more, which shall gradually lessen. They will increase in strength and gradually they seem to getting closer together, as if the two contractions are merging together. So as the labor progresses, the true labor pain gets stronger. And in true labor, one very important part to understand is that there is kind of a preparation of labor and when the true labor begins. So basically, whenever you are actually born in labor, we definitely see for other signs also, like your cervical softening, dilatation, which definitely the obstetrician has to do with the help of an internal checkup. There can be a passage of a mucus plug, which is blood-stained, or it might seem to be slightly pinkish in color. The bag of water might not burst at the beginning. It can happen actually at any stage of labor. The bag of water sometimes bursts at the beginning, and sometimes it might take a little time, and it might happen towards the mid labor too. So anytime you feel that the contractions, they are regular at intervals, they are getting more intense, they are not getting relieved by any position saying, please do not be hesitant to approach any of us. Because the true labor actually can be grouped into two different sections. One is wherein we feel that labor is nearing, and when labor has actually begun. So when the labor is nearing, your Braxton Hicks contractions might increase and your joint pains, basically the lower pelvis, will always have slightly more pains because labor is a play between different hormones which work towards preparation of your body towards labor. These hormones are released from your body as well as the fetus. So the hormone relaxin, which helps to relax our joints and basically the ligaments of the joints, loosens the various joints of the pelvic bones. Once the joints get loosened or the ligaments get loosened, the muscles have to work a little more to hold the joints in place. Hence, we see the changes in the gait. We feel that our gait has become more wobbly. So, this all works towards that labor is nearing. But labor begins with the true contraction. Though there are other symptoms like show, water discharge, bag of water discharge, and also the power. The power is nothing but our uterine contractions. So, this power which we gain with the help of uterine contractions actually is through the hormones of childbirth. You and your baby are born with the ability to start labor. It, which is because of the flow of hormone which drives this through. The role of the birth hormone is basically to get the labor process started. The main birth hormone is oxytocin, which is also known as the hormone of love. Oxytocin is released more so with lovemaking, the fertility is related to that, contractions, the birth process, your lactation, and the release of milk all are governed with oxytocin. Hence, even the post-delivery phase, wherein we try to minimize the blood loss from the mother's womb, is also related to the oxytocin. Hence, we practice to put the baby to the breast as soon as you deliver. The low levels of oxytocin can usually cause little problems, wherein sometimes a patient getting good contractions might suddenly, the contractions might reduce. And to maintain these oxytocin levels, we definitely tell the patient to stay calm. Sometimes even staying upright, you'll see patients walking outside the labor room because we also believe that the gravity and staying upright helps in this oxytocin release a little. So basically, understanding the real difference between the Braxton Hicks and true labor can help us releasing the anxiety and lessening the anxiety And hence, once you are more relaxed, you will be able to get through the process, or as you say, the power, the passenger, and the passage. All three can work in better coordination and ease out the delivery process. And with this, I would like to say that we are a team always available to you. So you need not fear, do not take stress or anxiety related to labor pain, as we are always there to support you. See, the main question, which always keeps us troubling apart from the pain part is that how will I be able to get through this? Whether I will be able to bear, when do I have to really approach the doctor? And after all this also, will my baby be fine? So we work together with the team of pediatricians to ensure that you reach us on time, and we help you at every step to coordinate this better. So the Braxton Hicks contraction, they usually will lessen with the change of position. So here I would also like to add that hydration or having plenty of fluids will always help you throughout your journey, whether it is the false labor or the true labor. And also one very important thing, that the hydration will help us avoid the risk of urinary infections, which is very important in pregnancy, because most of the time we see patients going towards the preterm labor pains because of asymptomatic bacteriuria, that is more bacteria in the urine, and also urinary infection is the commonest cause of pushing you towards preterm labor. So we are there for you, we are there to help, there to hear to you anytime. So do not hesitate to contact us. Thank you.
Thank you, Dr. Vibha. We have few queries. I will read them out for you.
Yes. Yes, I'm there.
Hello. Yeah.
Yeah, I can
So
hear
the
you.
so the first query is I am Jyoti and I had follicle monitoring this month, but results are not fruitful. My ovaries has fibroids. Are these fibroids a matter of concern for planning baby?
So here I would like to say that this definitely is more so towards planning of a pregnancy, and follicle monitoring is seeing the follicle growth. See, every cycle, when supposing you got your period today, after that from day 9 or day 10, we start with the follicle monitoring, and we see the follicle rupturing between the 12th and the 18th day. And follicle monitoring helps us to know the exact fertile period, because after the egg is released from the ovary, its lifespan is 24 to 48 hours, more fertilizing capacity in the first 24 hours. The sperms, once in the vaginal tract, have a lifespan of 48 to 72 hours, and more so, around 48 hours, they have the best fertilizing capacity. So once your follicle is showing ruptured, you should try to have relation around that time, like 2 to 3 days around that time. And Jyoti, your second part was that fibroids. See, fibroids usually are not ovarian concerns. Fibroids usually are uterine tumors. So in fibroids, I will say here that it depends upon fibroid treatment will always depend upon the size of the fibroid, the location of the fibroid, and also whether fibroid per se is giving a lot of symptoms. There are cases wherein we have seen that patient has already conceived and then we discover a fibroid. That does not indicate that first you have to remove the fibroid and then take towards the pregnancy. We try to manage that pregnancy with the fibroids, and definitely till one till a patient has at least one child, we do not like to interfere with any of the female genital organs, whether it is uterus or ovum, unless and until it is really mandatory. So in your case, if we know best that you can meet your gynae to know the size of the fibroids, or you can contact us with proper details, and we shall get back to you with a better information on this.
Thank you, doctor. The next query is it normal to have no Braxton Hicks contractions?
Yes, it is. Though we see that in 80% of the patients, and they can start any time from 20th week till your 37th or 40th week of pregnancy. But there have been few patients, a few cases where there have been no Braxton Hicks contractions, and the patient directly comes in with labor pains. But in the entire journey of your pregnancy, whether it is Braxton Hicks or just that pulling pain because of the round ligament tightening, we say, there can be few episodes when you might feel slight discomfort and slight pain. But if you've not had that, does not mean that there's anything which is abnormal. Yes, Jyoti, anything else?
Yeah, next question. What triggers Braxton Hicks contractions and how to stop them?
Yeah. So see, Braxton Hicks contractions are muscle tightening. Any contractions during the pregnancy and labor finally drop down to the hormone oxytocin. There is a alteration between progesterone and estrogen levels toward more so towards the later weeks of pregnancy, which helps in the release of oxytocin. That is the proposed theory for Braxton Hicks till date, though the exact cause of Braxton Hicks is still not known. For the true labor pain, there to keep ourselves hydrated well. So hydrate and full bladder is also sometimes the cause of initiating Braxton Hicks contractions. Sometimes it's because of having physical relations. So we definitely recommend the first 3 months and the last three. So last three, we usually tell you to avoid having any physical relation, because that also sometimes can release the oxytocin and start the contractions more.
Next query. How long will I have Braxton Hicks before real contractions?
So see, Braxton Hicks, as we mentioned, are more so towards the later weeks of pregnancy, and they are more so just a preparation of labor. There can be 3 to 4 episodes of Braxton Hicks, and you will feel frequently more towards the end before you go in labor. Though it is difficult to give an exact number here, because every pregnancy journey and every labor journey is very different and very unique to a patient. And hence, I think the most challenging part of this field is that, every patient has different expectations, which are fine, and every patient's journey is very different. So, but if you have noticed that your Braxton Hicks episodes are more frequent and they are coming at shorter intervals, you are experiencing time, then you should definitely go for a checkup. Though it might be that you just have to, the doctor sends you back, and you have to go back again when the real labor comes. But so to easing out, you have to keep on keeping yourself well hydrated. And also our regular physiotherapy sessions, which we have, they definitely help you to, keeping your pelvic girdle muscles and your ligaments, everything more eased out. So you will always be helped with them if you have these sessions. And also with the help of a proper diet, we should see that we do gain healthy weight. See, the minimum weight gain is 11 to 15 kgs in pregnancy. We want the patient to gain the ideal weight, but not through eating wrong foods. Our idea is not only the mother to gain the weight, idea is the baby has to gain right amount of proteins, as proteins are the building blocks. So we do not want our mothers to become obese. We just want them to be healthier, more vitamin C supplements so that they have proper collagen build up with the ligaments. I think this all will definitely help you towards a healthier journey.
Next query, Dr. Vibha.
Yeah.
I am 28 weeks pregnant. I have 1.15 centimeter gallbladder stone. Will it cause issues during delivery? I am having right side upper abdominal pain.
See, gallbladder stones in pregnancy, let me start from here, is that as your uterus grows, right, it pushes the diaphragm up. So there is certain amount of indigestion, fullness of stomach always. Also, the main reason for patients to feel gastritis after their first trimester, like when you are at 28 weeks, is because the movement of the food from the intestine, like our stomach usually gets empty in 2.5 hours. But in pregnancy, that same 2 hours can become 2.5, 3 hours because the movement of the food through the entire tract is very sluggish. Hence, it is very important that we eat small, frequent meals and relatively less fats. Now, with the gallstone, what happens is, and especially when you have pain on the right side, you need to be very careful with the diet. In pregnancy, unless and until the gallbladder is giving us trouble, and they say the gallstone will trouble you only when it gets stuck to the neck of that gallbladder. So here I will say that once you can have an opinion with the general surgeon, as this goes with the field of general surgeons more. But in pregnancy, especially at 28 weeks, we will try to manage this conservatively with a proper diet guidance, doing your liver function test regularly. In case anytime we feel that the liver function is slightly altered, we will help you with a tablet known as Udiliv, proper antacids, and a fat restricted diet but high on protein. So I'm sure that if we follow all this, you will be able to pass through this phase. And then post delivery, definitely we'll have a recheck again, so that if still needed, then we should go in for the removal, because gallbladder more so 90% has a surgical management. But one single stone, if it is in that bag of gallbladder, like how the pear is there, right? The neck of the pear, if it gets stuck there, then it creates a problem. So you make sure your diets are very healthy, and you once have a routine opinion from a general surgeon as well. And whenever we do ultrasound of your, like we do growth scans quite regularly, we can always have a check on the liver as well as the gallbladder scan regularly for you.
Next query, doctor. Is it necessary for the baby to drop before 37th week? If the baby still did not drop, will everything go fine?
See, yes, so the baby dropping, or what we call as lightening, usually happens around 37th week in the first pregnancy, what we call it as primees. But when it is second or third pregnancy, right, beyond the first one, which we call the patients as multiparous, this dropping can happen also during labor. So, is it mandatory? We'll say no, but the dropping of the baby at 37 weeks helps or gives you a very, very good indication that your inlet of the pelvis, see, when the baby has to move in the pelvis and it has crossed the head has crossed the inlet of the pelvis, that is when the engagement happens, or what we call as dropping. So once that has happened, that gives us a very, very fair idea about that the inlet of the pelvis is quite roomy, and we assess that yes, this patient will 99% progress through a normal labor. So not mandatory, but if it happens, that will help us in 2, 3 ways. First, your obstetrician will be happy that yes, you're progressing towards normal more. Second, you will yourself feel little lightened because the baby which had just grown up to your, upper, just below your chest, has actually come down. So you'll feel little lightening. Though at times this might increase your frequency of urine more, and you might feel like even going to pass stool really more often. But not mandatory. But in first pregnancy, definitely by 37th week, if the head has not got fixed, We start evaluating whether there is something pulling the baby back, a cord around the neck, or whether it is that baby's head is deflexed. See, when flexion means the head going closer to the neck. Whenever the head is flexed, then the fixing diameter of the baby is just 9.4 centimeter. And when the head is deflexed, the fixing diameter comes to around 14. So there's a lot of difference between the two measurements, and that fixing eases out the process of labor definitely.
How to know if leaking discharge is normal discharge or amniotic fluid leaking?
Yes, so see, one thing is there from the time we conceive, the estrogen and the progesterone hormones, they increase many folds. In general, also, if somebody who is non-pregnant will always have white discharge with women. They are nothing but the cervical secretions. Because the hormones are increasing, they will increase more. And here I would just like to add that for pregnant women, two infections which we really need to be taken care of are the vaginal and the urinary. So the best way to prevent the vaginal or the local private part infections are you should change your loads very frequently so that the area is maintained dry. As white discharge is definitely going to increase manifold. Now coming to the real question that whether it is the white discharge, which we call it as the sticky hormonal discharge, or it is the amniotic fluid. So the hormonal discharge usually will be sticky. It will be slightly thicker. It will not look like water. But the amniotic fluid usually will be like trickling of urine. It can vary in the amount from very small lakes because sometimes we see that we say that there are high lakes means your baby is in a big balloon of water. There can be sometimes a small rent, where it's just trickling small fluid. So if you feel that there is something which is wet in your clothes as you go on changing, still it wet, definitely you should contact the doctor who with the proper per speculum examination can differentiate this. And we can always have a scan to check whether the amniotic fluid around the baby is normal or not.
Thank you, doctor. The next query is, I have heard stories from mothers about their experience of long labor after their water breaks. My question is, how long after the water breaks is it safe for the baby to still be inside the womb? In other words, within how many hours of water breaking should the baby be delivered?
So as your question is that once the water the bag of water, right? It protects your baby because till the time the water breaks, the baby is in a sterile environment completely. So the vaginal flora, the bacteria, we have bacteria which are staying in our vagina also. So this is true that once the water bag of water breaks, we do not like to wait for too long. 6 to 8 hours or max, mostly we like to deliver the baby. So we try our best that just to augment the contraction. Once we feel that you've lost a lot of water, we see that how best we can help you with induction so that the gap between the bag of water rupturing and the delivering of the baby is not beyond 6 to 8 hours. In this scenario, one more precaution which we always like to take is we will do a CBC to see the WBC count is in control. It is not showing infection. We cover you with antibiotics which are safer for the baby. And we try to minimize on internal checkups too many. And only, as and when needed, definitely they have to be done with even more stricter sterile techniques, which we definitely follow best at Cloud9. So 6 to 8 hours, you need not worry.
Sure, Dr. Vibha. And the next query is, how to identify a leaking water break?
Yes, I think this is again the same thing where leaking water break is, I think if I have to say in one line, it is something which patients usually to us come with a complaint. If they are on a call, they'll say the doctor, I am passing urine very often and I am actually, my clothes are getting wet. So this is mostly, but then, this is when it is more in amount. But there are times when, we see it as just a small trickle also. So if you feel that constantly a small trickle or a drop of urine, how it passes, this is how when you feel, you should definitely approach us, because this could be the amniotic fluid. The white discharge which we have secondary to hormones is mostly the sticky discharge. It will not need you a pad or a change often. It will not wet your clothes. It will definitely stain, but it will not wet your clothes.
We have few more queries.
Yes.
At what stage of labor is an epidural administered? What are the pros and cons, long-term side effects of epidural?
So, see, epidural, as we call it as a painless delivery, is here. First thing I would like to add is that definitely we have an excellent team of anesthetists with us whenever we take the decision for epidural. So, what is epidural is? Epidural is a analgesia kind or anesthesia given to you in your lower spine, which just blocks the pain perception to you. Means the pain and contractions are there, but you are not able to feel the pain. So it is, and at what stage it can be administered? See, there are times when the patient starts even from the beginning of the active stage of labor, which we say when you are 2 to 3 centimeters dilated. But sometimes the patient initially says, Doctor, I'll try my best to bear. In case I'm not, then I will take to this. So this decision can be taken at any stage of labor, but more so it is at the beginning of the active stage of labor. Now, pros and cons, definitely it relaxes the mother better. She's more calmer. So when you're more calm, the natural oxytocin release is better. The disadvantage is, one is definitely you have been given an anesthesia in the spine, but I think with the anesthetist team, good, and the kind of aseptic techniques or sterile techniques we maintain at Cloud9, we have never seen any problems with the epidural per se. But one thing I would like to add as disadvantage, you can say basically, or something which is not needed for every normal labor, is that in the second stage of labor, sometimes we have to support the head of the baby, or we have to pull out because you're bearing down sometimes is not as strong as it should be. So we have to just support with a vacuum to help you through that second stage of labor. So there is what we intervene then. Otherwise, it has many advantages, and it definitely helps in, easing out the process of the normal labor. And one more thing I would like to add is many patients feel that if they take epidural, then they will not deliver normally and they'll end up more with operative delivery. So it is nothing related to the epidural, because normal labor is more so, as I said, passage, passenger, and the power. It is how the baby's head rotates. Every patient is different. Every head rotation of the baby and the movements are unique to a patient. So, and everybody strives their best to deliver you normally. Only if it is going in the interest of the mother or the baby, the decision of C-section is taken, which is not because of epidural. In fact, the advantage here is that if you have to take to epidural, if you have to go in for C-section, the same epidural which you had given, you can always, help with your C-section also, and then post-operative analgesia also.
Next query, ma'am. Ma'am, what is the possibility of having a VBAC for my second baby? Because my first baby was a C-section, so I'm clueless what a water bag burst would feel like.
Okay. So see, one cesarean section really does not mean that every time it is a C-section. We can always work towards the vaginal delivery after a first C-section. Very important here is the reason the first C-section was done. If it was for cephalopelvic disproportion, means the pelvis of the mother was very tight, or it was funnel shaped, or we somewhere felt that the bony pelvis was inadequate, then definitely, there are reasons of recurrent C-section there, wherein And also here that if with a previous C-section, if the baby's positioning is not cephalic or head down, if it is breech or it is transverse, what we say is horizontal, then definitely it is a planned C-section or if it is twins. But if you have all other things in place, then just having a first C-section does not mean that you will have a C-section, though chances are slightly higher because you have one weak point in the uterus, which is the scar. So we have to start monitoring that scar thickness more so from the 36th week of pregnancy, just to see that there is no thinning of that scar. Those cesareans are done with best possible techniques. We take best possible precautions, and it is done commonly taking due care that for future also. But every human body is unique. The wound healing definitely is as per the body different. So we do monitor this, but you can be rest assured that you can always try for a normal, even if you have a first C-section.
Doctor, we have last two generic questions. What is the ideal baby birth weight, and what
Mhm.
things to be taken care of in the first pregnancy?
Okay, so see the ideal birth weight for our Indian standards will be 2.8 to 3.2. Though we see definitely in today's date with such regular appointments with the doctors and a regular care, patients themselves also really take extra care and they do follow through the routine investigations and healthy diet. So averagely we see that at least it touches 3 kg and but any weight beyond 2.8 is considered as normal. And what care should we take in the pregnancy, in first pregnancy? I'll say, I mean, any pregnancy for that matter, since it is, a new life for a mother and baby, and we deal with two lives together. So, most important is the diet and the exercise guided with under a specialist. And also, we have to see, they say you are what you eat, right? So, I mean, we don't have to overeat in terms of fats. We just have to eat the right food so that the baby's weight is really good. See, sometimes, our moms and all, they feel that if the baby is overweight, then it will be difficult to deliver vaginally. No, a fitter baby, a healthier baby, a normal delivery is a stress to the baby also. So, a fitter and a healthier baby can take that stress much better as the weaker one. And mother definitely gaining the weight, right weight, but not obese. So that, and especially see nowadays we are seeing more late pregnancies, mean most of the patients are planning pregnancies after 30s, 35s also. So if you maintain the right diet, the less chances of diabetes in pregnancy, less chances of blood pressure in pregnancy. And the best outcome of a normal vaginal delivery is when we do not have to intervene artificially. We consider this as a natural process because you and your baby have the hormones within you. Actually, the main process which starts the labor. So we do not want to actually intervene unless and until a reason is there. So with our healthy diet, regular follow-ups with the doctors, regular scans, again, I'll add this that no matter how many sonographies or ultrasound, whatever you say, ultrasonography, all three are the same. They are safe for the baby, 200% safe. So you really need not worry. A regular monitoring will always help. And an obstetrician definitely forms a bond with the patient. And nowadays, with everything available, we are just a call away. So we can always help you at any step. And regular monitoring, a healthy diet, and exercise sessions, if all your reports allow so, will definitely help us a lot.
Thank you, Dr. Vibha. We take the final query as we have more
Yeah.
queries coming in. When does dilation take place for normal delivery?
Yeah, so see the labor. Now, if we talk about true labor, no, there are two phases of labor. One is a latent phase, one is an active phase. So even after the labor pains start, initially there might be, the frequency might be less, or the gap can be every 10 minutes also, lasting for a shorter duration. So the first phase of labor, the latent phase of labor, can last very long. It can be more than 10 hours also. So the active phase of labor is when you start dilating. That is from 3 centimeters onwards. We start the active phase, 3 to that 10 centimeters. So the duration of labor in a first pregnancy can be anywhere from 16 to 18 hours also. Though in the second one, it might just finish in around 8 to 10 hours, sometimes even shorter. So it also, so that definitely whether you're born in your active phase of labor or not, that an obstetrician can tell so better after the internal checkups done.
Thank you very much, Dr. Vibha. We have got all the queries answered. Thank you very much for
Thank
your
you so much, Jyoti. Thanks.
Thank you.
And in the end, I would just like to say that we are always there to help and to hear and to heal. So anytime, anybody, and we have doctors round the clock on Cloud9. So, so definitely all the patients, anything, they can always approach the doctor and also the on-call doctors to get it resolved. But never be reluctant to approach the doctor, as we are dealing with the most sensitive part of the pregnancy and delivery and, getting a new life into the world. Thank you so much.
Thank you.